we're going to do a case study and then talk about a smaller network that we have set up across Canada, just so you know that it exists, and that's and then moving on to the big idea. And the big idea is really the work that Jemal's been doing, and he's going to talk about, which is about community governance. This slide deck will be available to you, you know, use it liberally, but make sure that it is properly cited. So next slide, please. So just a case study, just to get you everybody onto the same page of why we're interested in doing this. So the next slide, please. And I want to take you back to 2020, the height of the COVID, the start of the COVID-19 pandemic, when we knew that rates of infection in UK and USA Black populations was high. But we didn't know what was happening in Canada. We didn't have the data. We didn't have the data to know whether the same high rates in Black populations in the UK and the USA were being seen in Canada. And that's around the times of the rise of Black Lives Matter because of the death of George Floyd. And so what was born from this necessity was the Black Health Equity Working Group, and Wellesley Institute was one of the founders of this. And it was a cross-sector group, including community, people who work with community, academics and policymakers, all saying, we need information, we need this information to make our pandemic strategy better. Next slide, please. And the aim wasn't just the data. And that's really what Wellesley is all about, and what the work that we're doing is all about. Race-based data and sociodemographic data, as you will all know, is the means, not the aim. And the aim was to have a data-driven quantification of what was happening in COVID, to be able to identify disparities, monitor, and for transparency, so that people knew what was going on in communities. And the idea was to use these data to produce an evidence-informed, community-driven public health and policy solutions that would decrease any disparities that were identified. Next slide, please. And there was a strategy to doing this, because governments didn't want to collect individual level data. And so we started off by trying to promote the use of the data we already had. And so Toronto area level data, so we knew the percentage of racialized populations of low income people in particular areas, because we didn't have individual level data. And we were able to see in Toronto that there were areas, and these are the dark blue areas in the northwest, where the cases of COVID were 10 times that there were in other parts of Toronto. So it's a map of Toronto you've got here with the different areas on it. And the best predictors of the rate of COVID was the percentage of racialized populations in an area, then percentage of low income, and then overcrowding. And obviously, once you get these data out there, there's a momentum that happens in the media for change. People wanted to move forward. So that area-based analysis underscored the need for individual level sociodemographic data, and people started collecting it. First, on the outskirts of Toronto, the London and Middlesex public health unit, then Peel, then, as you know, Manitoba. I think Manitoba may have been slightly before. And then Toronto started collecting data. And we're based in Ontario, so we were trying to push things in Ontario. Ontario then changed their law so that they allowed provincial sociodemographic and race-based data in COVID in order to change provincial policies. And by August 2020, when data started coming back about what was happening in Toronto, Toronto found the rates that were so different for different groups that they consulted communities and said, what can we do? And so that idea of a community-focused, community-developed equity plan, which was the dream of the Black Health Equity Working Group, was something that was enacted in Toronto. And if I can just have the next slide, and this is from an article that we published in one of the Lancet publications, just to demonstrate that this data made a big difference. Having the data, analyzing the data, publishing the data, and then having the data used really made a difference. So what you're seeing here is you're seeing the rate ratios of COVID-19 for different racialized groups in Toronto compared to the white population. And this is from June to December 2020. And if, say, for instance, we take the second line, which is the Black population, in June 2020, the rate of COVID was 6 times that of the white population. By July, it had gone up to 8 times, and by August, it was 9 times the rate of the white population. August in Toronto was where that equity-driven, community-based consultation took part, and they changed or modified some of the COVID response. And when they modified the COVID response, you can see how the relative, the rate ratios decreased, so that by the time you get to December 2020, the rate of COVID, it's still a disparity, it's still twice the rate for the Black population compared to the white, but the rate ratio has come down from 9 to 2. And actually, if you look at all of those lines, whether it's the red line, which is the Latin American population, the purple line, which is the Southeast Asian population, or the green line, which is the South Asian population, the rate ratios of COVID were lower in December compared to June, and they're linked to that community-based strategy. So next slide, please. And so we take from this, and the reason for putting this first is that the people who work with the Wellesley are really focused not just on the data, but what the data can do. It's not just data collection we're interested in, or data presence. It's data use to power equity, to power change. That's what we're interested in. And so where we have got to, and this is the second piece of the presentation, is we started looking at who was collecting race and sociodemographic data around Canada. And we found that there's actually lots going on, whether it's the federal agencies who have initiatives, CIHI, ESDC, the Anti-Racism Secretariat, Public Health Agency of Canada, or Statistics Canada. Next slide. And we also found that in health, there were particular provinces who were accelerating the collection of race-based and other data. So Nova Scotia was collecting data on its health card, which it was going to use to drive equity. Manitoba were collecting race and sociodemographic data at point of contact for health services, initially hospitals, then community, and then going forward to try and get a more comprehensive data set. And British Columbia were going a different way. They were doing a demographic survey of what they hoped would be 13% of the population, a sample of 13% of the population. And our understanding was that that sample and that information was going to be merged with the sociodemographic and race-based information was going to be merged with government data on a number of different types of services to be able to look at disparities in access, use, and outcome. And so they're going down the survey route. Manitoba are going in health at point of care, and Nova Scotia are going via health card. But what was clear to us was that when we went going round the country asking people what was being done about race-based data, that the different groups were not necessarily talking to each other. And so we were wanting to try and think of how you get quality in race-based and sociodemographic data collection. And we thought one of the first things that could be done was to bring everybody together. And so the innovation and the simple big idea on trying to get to the what and how of race-based data collection was to convene a space. A space for cross-pollination of ideas, for relationship building between national, provincial, and local initiatives, a place where eventually some sort of consensus could be built about the approach to not just collection, but use and governance of race-based data, because there are loads of outstanding questions in this fast-moving area. And when we set up the initial conversations using the sort of Chatham House rules model, we were asked to convene the space, and we have been convening the space where it started small, but it's growing and growing and growing. A number of people meet, so CAI, BC Data Services, Anti-Racism Directorate, PHAC, Nova Scotia Department of Health and Wellness, BT Data Services, there twice, places in Manitoba, Saskatchewan, because they've previously been collecting these sorts of data, and then some of the Ontario groups such as Ontario Health, Human Rights in Ontario, Public Health Ontario, Ontario's Anti-Racism Directorate, and also the Privacy Commissioner of Ontario have all started sitting and thinking about these issues. And next slide, please. And there are potential areas that really need consideration, and that this group is trying to think about interoperability. Is it possible that these different initiatives can create a race-based data and health ecosystem that will allow interoperability, but also allow the social determinants of health data from elsewhere to be properly included? Is there agreement on what variables should be collected? Maybe a basic data set, which would be different, which then could be amplified and added and changed for different places. There's variability in how this is collected. What does this mean for the data and the biases and the samples that you get? Best strategies for data use. But really one of the big questions, and this is a question that Jemal has been wrestling with, is we're in a data ecosystem where trust is important, where things have changed significantly, and where when you have big data, especially data with sensitive sociodemographic or race-based race-based data, variables being connected, that people really want more involvement and more say in that data use and the data collection. And so there's this big question which has come of trust and also of what community governance and community involvement looks like. And now I'll pass this over. Next slide, please. And Jemal, would you mind taking over from here?
Sure. So thank you for leading a lot into the context of the work that I've been doing at the Wellesley Institute. So a lot of the conversations that we've had around race-based and sociodemographic data have been around what is happening, what is being done. But I think it's very important for us to have you know, future forward perspective on what we want to achieve and what we want to do. I think, I'll go to the next slide. I think, a very important thing to foundationally set is the fact that, yeah, big data. Everyone is talking about data, whether they're thinking about the ways that their searches are turning into advertisements, people getting afraid of accepting cookies on every single website. I think standardly Canadians across the board understand that data, is leading to a higher sense of being monitored. And so that said, there are some population groups that are concerned a bit more around how that's going to impact their communities. And so then we have to think about, whether the data that we are currently collecting through the initiatives that are happening actually reflect the ways that communities want to be represented, and the way that we're analyzing the data, again, reflects perspectives on what could be most useful, what is actually needed. So without that approach, what we will start to see is not only an erosion of community trust, but it means that the data that we have will not be useful. If we are trying to have data-informed, evidence-based decision-making, I think it's incredibly important for us to understand that we need to have the right perspectives in a room, right? You want the right experts involved if you're going to making a clinical decision. And in the exact same way, if you're using community data, you need communities involved to be able to make those decisions as well. So as I just alluded to, some communities have different experiences with information. I don't think a lot of this will be new, right? And focus on Black communities here in Canada. So there are lots of examples time and time again, if you were to do any community consultation, where you're going to hear that, whether it was a research initiative where people were asked about their experiences of healthcare services, or if we're thinking about the ways that people are followed across multiple years to track their child's health outcomes. What people often see is that once the research study finishes, that there's not a cyclical way of doing where people receive benefits. And in addition to that, what we also see is the data being analyzed or interpreted in a way that actually leads to victim blaming of an entire population, where you'll start to see systemic issues all of a sudden be misinterpreted as poor behaviors. And that's what we need to address, and that's what we need to do, when instead you should be focusing on the root problem. And so another important thing is the lack of data that is available to drive equity. What you'll often see is very specific questions being asked around, even if, let's say, race. But if you don't have all the other variables included to contextualize why race actually matters in the context of a specific issue, what you then see again is a poor conclusions being made. And that actually has very strong impacts on the way that people receive services. And lastly, the monetization of data. I think that's the largest fear that a lot of people have, is not only will it be extracted and not benefit them, but actually those who collected the data will receive monetary gain and status as a result of their involvement or participation. And that's where the EGAP framework comes in. So it stands for engagement, governance, access, and protections. So as Kwame already spoke about the Black Health Equity Working Group and the context through which they formed, I think it's very important to talk about something that they worked on through great consultation with community leaders, health advocates, as well as leaders and those who have used data to inform change in our healthcare system. So as we start to think about, we're going out, we're asking people to provide such sensitive information that they may not be comfortable to do. And if there's already a history or precedent set that said, okay, you're going to give this information and nothing will come back to you to benefit you, then there's a fear of, why should I do this going forward? And that box, or that question mark, is often a source of fear for people. So if we were to understand a way of working where people have control over its use, or how it's going to be shared, or how it's going to be accessed, and that's going to be incredibly important to build community trust as we try and use equity data to inform our strategic planning. And so that's what the EGAP framework aims to do: support data sovereignty for Black communities so that they are actually have the data in their own hands and be able to make the decisions over them. And so engagement, standing for the way that we need to see cyclical engagement with communities to actually understand what are the data issues that are most important to their day-to-day lives, as well as trying to get a sense of, if we wanted to get people involved more and more in making decisions around data, that can be a bit challenging if you don't understand the baseline that is already set on how people understand data, as well as how people understand your organization. And then the second part is governance, speaking to the formation of governance tables, where community members and advocates and leaders will be able to come into a space and engage with institutions that hold health data and have the conversations around what are the provisions that are necessary to have this be in an ethical space, to have the data not only held to the standards of legislation or regulatory compliance, but community perspectives as well. And so in doing that, that comes to the next two parts, which is access, right? Communities, in order to make the decisions that are important for data sovereignty, they need to have the right to decide who's going to have access to that data and who isn't going to, as well as under what provisions, what will be required of those who want to access race-based data. And then lastly, the integrity of not only the governance table, but the powers of deciding access means that we also need to understand that the data needs to be protected in a way. There can't be a free flow of information that is uncontrolled. Otherwise, there is no safety in Black communities providing the race-based data to these institutions. And one thing, even before going forward into the next slide, to understand about EGAP is it's not a standardized template that will be the same across different organizations. We're able to list already different, whether they're local, regional, provincial, and national organizations that are working on having equity data. It's going to look incredibly different if you are the one who actually engages with patients and has them in an EMR versus those who receive information and analyze it, or those who are just starting a research project, right? You're going to think about the type of data that you have, the context through which you plan to use it, as well as the authority that you have over the data that you're collecting. And so this is great in theory, and I think often what people want to see more and more is, what does this look like in practice? And this is where the Toronto region of Ontario Health came in with their anti-racism strategy. And as part of the way that they were trying to address inequities experienced by Black communities, they really recognized the power and impact that the EGAP framework could have and decided that they would like to pilot it. And so multiple health service providers agreed to pilot the implementation of EGAP. So people stepped up, some of which are here today, so I'm happy to see them here, and said that they would, in one way or another, try to just start this journey. And so what we did as the Wellesley Institute is follow these early adopters to capture their narrative journeys and experiences. So going into meetings, collecting the documents that are used for different planning and initiatives, seeing what community events are being established, so that you can get a sense of what do the first stages even look like, all in the goal of developing an implementation guide, because using the learnings from these early adopters, what is intended to happen is to scale this up, right? Make this an expectation rather than an addition. And so I think, blankly, when we first started this initiative, we were thinking through, where do we even start? How are we going to more or less assess or try and structure the journeys that people are going on? So with these different categories of action. So the first one, organizational agreement and readiness. We knew beforehand that it was going to be incredibly important for organizations to feel that they are ready to enter this journey. And that means having commitments in your strategic planning, understanding who in your roles of leadership, whether that's an exec committee or the board of directors, who needs to say that this is something that we want to do, as well as understanding the data holdings that you have available to yourself and how data governance is currently practiced. Because what this does is it allows you to understand where you are and how you can move towards EGAP as a way of working. And so building that sustainable internal organizational architecture will be incredibly important to keep the drive going, right? And so that also includes agreeing on the scope and identifying the resources as well. And once you have that kind of in-house ready, then what you would want to be able to do, or what we would want to see, is community engagement really start to come in. Right, you have the resources, and you start to just identify some partners that you will take a first start with, and try and just decide, using an evidence-based model of community engagement, what partnership looks like, all in the hopes that you can make an agreement on what the expectations are as you're having these conversations around data. And I think what's important to say as well is there's no right way of going about this. There's no right way of engagement. Right, it's just incredibly important for people to start to understand how their organizations are being perceived and will be received by communities. And so having that engagement strategy will be incredibly important as we move forward and think about setting up the governance tables. So identifying a few people after you've had engagement, you'll have a better sense of what's happening and who needs to be involved to form a governance table. And through there, you can identify an action and accountability mechanism for the governance table internally for itself, but also how that relationship between the institution and the governance table will operate. And so you can set a very clear terms of reference in whichever way is most accessible to the people or those who are on the table, and decide on what period of meetings or what the processes look like. And I think it's incredibly important for people to be creative as they go through these. I think some of even the language that I just used, terms of reference or period of meetings, that may not be the way that people want to work, but that's why it's incredibly important to have engagement there, to know what the best ways of getting information and making decisions are, so that you can make those decisions. And so then we get into access, where community agencies and those within the community can also just decide what information is required and who do they have to go to get that. And so partnering and as well as supporting capacity and training with researchers as well will create an ecosystem where the data is not only going to be sent forward towards whether it's a repository or a trust or a place where people can access the information, but you understand and can believe that those who access that information will be held accountable for their own uses. And then lastly, again, as I just talked about, is actually implementing the governance table guidelines. So balancing access, right? You want those to be able, the people to be able to access the information. What you also want to be able to do is ensure that there's going to be proper use, right? So the privacy and access pieces. And so what did this actually look like once we started to go? These are some very broad generalizations of themes that we found. I think it's incredibly important to mention that there's so much work that goes into even the beginning. I think it would be ambitious to say, once, reflecting on the end, that setting up a community governance table can happen in a matter of months. There's a lot of work that needs to happen. And first, what we saw was, as we already kind of knew, is establishing that readiness and awareness. And some of the ways that we saw, these early adopters do it is building an equity-oriented culture, right? Including that in the language, whether that is mass emails that are being sent, team huddles, building that awareness that this is an initiative that the organization really believes in. And then also aligning workforce structures with your equity goals. So is there a connection between those in human resources and those in education? Is your equity team standing alone, by itself, or are they actually integrated into the ways that data is being processed? As well as advocating for EGAP awareness and understanding. So circulating the EGAP framework, bringing it up in meetings, ensuring that if you're talking about race-based data, that EGAP is there. I think that was incredibly important to not only, as I said, build awareness, but keep the momentum being pushed forward so that it's not forgotten. And then I think another thing to mention is addressing challenges around the perceptions of EGAP or the collection of race-based data. What I think will be, useful based on what we saw with the early adopters, is having standard templates to talk to your staff about why this data is being collected, why it's important to prioritize, Black communities in this example, around the organizational decision making. And so going into the second part, developing an equitable data infrastructure, what you want to do is assess, do you even have the pieces together from a technical point of view to implement EGAP? I think there can be some gaps in understandings as people have very specific roles. I think anyone who works in even a small to large organization understands how silos can really stifle change. And so what needs to happen is the combination of perspectives and expertise within an organization, so that those who understand the data are in the same room as those who are responsible for its privacy. And then in addition to those who work on community engagement and equity initiatives, so that there's a built practice around how the organization takes race-based data differently than other ways of data, how engagement is going to be critically important as they collect that. And then lastly, building the collaborative partnerships. I think it was really incredible to see this happen at multiple levels. The first one internally. There are lots of different working groups and committees that I think were important to driving change, not necessarily within the same team or same department, but across the entire organization, whether it is just members who are interested in the work, but also intentionally including those in leadership roles in these spaces so that there's an accountability there. And then also another level was externally. So what we saw was not only within an organization, but they're aligning with similar ones, or engaging in networks and having committees at a regional level, so that this is not just something that the single institution takes seriously, but what you want to build is communal accountability, and ensures that an organization understands that if they don't do this, they're going to have to catch up later. And then lastly, what we saw were some great examples of engaging with communities of patients. And one early adopter actually had an entire workshop dedicated to EGAP and engage Black communities to understand what their first perceptions are. Do they believe it's important? And how would they like to practice that? And the goal of that early adopter had was to take it back and use it in its strategic planning process, because they were in a renewal period. And I think that was a great example of how you can empower people and include them in the conversations as you just start, even if you're not ready. And then next we have, an example from the City of Toronto. So the City of Toronto governs a lot of different data sets, not just health. And they wanted to build a strategic plan to address inequities. And so we saw things across healthcare, housing, child welfare, and justice. And so this created a different perspective. And that's why we knew that we needed to have a different approach. So that's in developing the framework, the Black Community Data Governance Framework, we understood at first, let's go into the literature, let's understand what current practices or understandings are across the world. And we were able to get a lot of different practice examples. And then we had an internal scan where we talked to City of Toronto staff members themselves to understand what the gaps are and how we could even start to piece something together so that they felt ready enough to engage with communities. We also established a Black Data Advisory Circle, so experts who actually understand the importance of having this data, as well as how it could actually be implemented into decision-making. And once we were able to do that, we had a preliminary prototype framework based on the literature review and the internal scan and the advisory circle expertise, and we brought that to communities. And they ripped it apart, said that this needs to be added, this needs to be emphasized. But even generally, everyone found the importance in this work. And that's what landed us on the final framework. And so, there's lots I could say about this, but I'm trying to also keep it short to make sure we have time for questions. So, of course, we have some general principles that were developed. Everyone wanted to make sure that data was used for progress, that there was accountability and transparency in what is being done. But then in that first objective, it's hard to just tell the story of this framework. It's that at first, what we want to ensure is that community governance and decision-making is being established and prioritized within the city. And once you're able to do that, you want to use that governance table to guide how that data ecosystem is going to work, where you're going to bring everyone together or bring all the data together to ensure that you're ready to have it. So the responsibility, are there accountabilities built in? Do you have the architecture? And is there standards being made across the different divisions? And lastly, once you have that data infrastructure ready, now you can actually start thinking about using this data. So ways of management, control, and use, all of which to come to different outcomes that we want to have, which is building trust with Black communities through engagement. We want to center Black voices in decision-making. We essentially, again, data is used for the good of Black communities. So we can see both a principle and an outcome, so that there's that cycle, right? And so lastly, to really close this at least part up, we're now seeing the implementation of this framework going, throughout the city. There's some great uptake happening, and we're really excited to see this as this work goes forward, as we start to establish community governance processes and how it can actually be implemented. So lastly, to summarize, we can see that the collection and use of sociodemographic data and race-based data can influence and improve health equity. We're seeing that across the country. And what we're trying to do as Wellesley Institute is bring alignment on how this is being done to ensure that we all get to the same destination, which is ensuring that health outcomes does not rely on one's identity, but standardly that everyone is able to receive, the health services they need to have, the well-being that they deserve. And lastly, we can see the models of community governance being set up in different places, and it's going to be exciting to see these practice in the coming years. So with that said, thank you very much.